Hi friends, Dr. Mitali Upadhye here. Welcome to Tips on Cancer by Dr. Mitali Upadhye. While I was healing from my cancer in June 2013, I realized that diet and nutrition was a very important aspect of my healing. With my self-experience, what I would like to share with you, and which is that sugar is one of the main ingredients which makes our blood acidic. Cancer cells are known to thrive and grow in acidic environment. More than 90% of the cancers are known to grow in acidic environment. As a result, it becomes our prime duty as to see that we do not eat any of the food items which will make our environment, blood environment or blood pH acidic. Naturally, whatever pollution is there in the environment, is there in the water, is beyond our control, and there is very little that we can do about it. Hence, food remains one of the major aspects on which we can work to help our body. Sugar is a cancer feeder. Cancer cells are known to feed on sugar. Hence, cut out sugar completely from your diet. Sugar in its natural form, as well as sugar items, food prepared from sugar, sweets made from sugar, sugar in your tea. These are things that you will, tea or coffee is something that you will refrain from completely during your cancer treatment. Even taking sweeteners like Equal or NutraSweet is not very healthy because it contains aspartame. Aspartame is a known carcinogen and hence best to stay away from them. Then coming to the next important item is milk. Milk is known to cause mucus, create mucus. In Ayurveda, we call it as kaphajanya. That is the reason why milk is again causing cancer. Cancer cells tend to feed on mucus. Again, milk becomes a ready food for cancer cells. So the first important thing as cancer patients is to refrain from milk and milk products and milk items, sweet or savory in any form. That would mainly include your milk, it will include your paneer, your cheese, even your yogurts, which are especially the sweetened yogurts. In little amount we can have curds, and in large amounts we can have buttermilk. The buttermilk that we usually prepare contains 25% of curd and 75% of water. So a thin buttermilk is nutritious for the health, is good for the health, and you can have it during your treatment. But otherwise, any other form of milk is a definite no when it comes to healing from cancer. The third very important food item is non-veg food, meat in any form. So that would include your chicken, it will include your mutton, your beef, your pork, your eggs as well as your fish. Though I would say to a certain amount we can have our eggs and fish to give us the protein that we are looking for, because protein is also an important aspect of our nutrition, and we would need a good amount of protein for our body to fight the cancer cells. So fish and egg can be made an exception in small quantities. Otherwise, any of the non-veg food tends to once again make our blood pH acidic. And hence, refraining from non-veg is the best way to go. Go vegan, and because digestion of non-veg takes a lot of time. It takes a lot of digestive enzymes. These enzymes instead the body can use to combat and tackle the cancer cells in our body. Also, a lot of amount of energy, urja, prana, is involved in digestion of non-veg food. This energy, this prana, this urja can be now diverted to our healing, can be now diverted to tackling our cancer cells. This is again one of the major important reasons why I preferred putting a complete no on my non-veg food. Yes, I was a fish lover and I really enjoyed eating fish. So I did give myself little leverage of eating fish on and off. Apart from that, table salt again is something that would cause the medium blood acidic pH to become acidic. So refrain from eating too much salt. You can have normal salt in your food, but do not take table salt. Do not take salt on your salads, or don't try and have food items that are very salty like chips or farsan items. Next important thing is the refined flour, that is maida. Any of the processed foods when it comes to toast, biscuits, curries, breads, buns, pizzas, burgers, any of these processed items that are made basically from refined flour tend to again make our blood pH acidic. Apart from that, they tend to stick to the walls of our intestine, especially the small intestine, large intestine. This makes absorption of the healthy nutrients very difficult. At this time of crisis, getting the right nutrients in the right proportion is very, very important, and we do not want anything to interfere in this absorption. Maida or refined flour makes absorption difficult, and as a result, refraining from any kind of processed food or using excess of maida in even home cooked food, it would be the best way to go when it comes to eating wholesome food, holistic diet. These are the list of all the don'ts that we need to take care of. What are the do's that need to be done? What I decided to do was, I decided to see to it that I ate wholesome meals the whole day. I ensured that I had a good sumptuous breakfast, which was freshly cooked, simple foods like maybe upma, dalia, dosas, chilas, parathas, vegetable parathas, thalipits, which are freshly made. So my first meal of the day, that is my breakfast, was sumptuous, healthy and freshly made. I also ensured to it that I had a lot of juices along with it. Carrot juice is again one of the most important juices, full of the right amount of antioxidants needed to combat cancer cells. We could make a beautiful combination of carrot juice, carrot and beet and tomato, carrot and pomegranate. These are some wonderful juice combinations which could be done, which you could have in the morning with your breakfast. So one whole glass of freshly processed or cold pressed juice, followed with a good healthy freshly made breakfast, is what I always opted for my breakfast. The next important meal would be that of lunch. Simple lunch that we normally have is which contains more amount of vegetables, more amount of salads and less amount of carbs is what one would go for. Ideally 20% of cooked and carb food and 80% of uncooked or vegetables or is what should be the ratio when you go for your diet, when it comes to even your lunch or your dinners. Eating one whole fruit every day was what I incorporated in my diet, and with my experience with myself and my patients, I found pomegranate to contain the best antioxidants which can help combat cancer cells. So eating one whole pomegranate every day for 3 months, 4 months, 6 months is something that I would recommend to all my listeners when it comes to eating fruits. Any fruits are fine, all fruits are good and give you the right amount of antioxidants, but with my personal experience I found pomegranate for cancer to be one of the best fruits to go for. When it comes to salads, broccolis, cherry tomatoes and any of the fresh salads is something that you should eat in sumptuous amounts both during your lunch as well as your dinners. Dinners, usually see to it that you have them early, keep the quantities or proportions small. There are no restrictions on what you eat so long as the food is fresh and freshly prepared. A lot of soups and salads could be incorporated in your dinners, which would make sure that you have the right amount and right proportion of healthy food. So when it comes to cooking the food, the way you cook food would be, see to it that the temperatures are low, see to it that the food is half cooked. Anything that is cooked beyond 40 degrees centigrade tends to destroy the enzymes and the micronutrients and the vitamins, as we all know. And this is something that we would not like to have. Because when it comes to cancer, nutritional deficiencies are seen at a large level. Most of the time, cancer patients have a lot of nutritional deficiencies. And rather, these nutritional deficiencies are the precursors to cancer. And correcting these nutritional deficiencies is very important. Taking the right amount of food so that these nutritional deficiencies get corrected, or even supplements if needed to correct these nutritional deficiencies, becomes very important when we are healing with our cancer. Lastly, before we close, I want you to remember we are what we eat. Hence, eat healthy, stay healthy, and heal soon. Thank you.